Dave, go for intro.
Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to our weekly update on the latest in COVID-19 news and information for the City of Amarillo. I'm going to go ahead and introduce who is on our panel today. We are joined by Amarillo Mayor Ginger Nelson, City of Amarillo Public Health Director Casey Stoughton, Dr. Scott Milton, Public Health Authority, Texas State University Health Sciences Center, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Lamontier, Chief Medical Officer for BSA, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. At this time, I'm going to turn it over to our panel. We'll start with Amarillo Mayor Ginger Nelson. Mayor, how are you?
I'm well, thank you, Dave, and good morning, Amarillo. Well, we are now still in the COVID marathon, and as much as we wish this was a sprint and that we were coming close to the finish line, I think all of us are beginning to settle in and realize as we begin to talk about school starting, will school start, fall sports, what will that look like? Can we do that? It's beginning to settle on us that this is a COVID marathon. The finish line is not close in sight. I do believe there will be one, but it's not that it's upon us right now. And so, I have many friends that are marathon runners. And one of the things that they've taught me over the years is that when you're running a race, the longer the race, the more you have to learn the skill of recovering while you run. And we have to recover while we're on the race. We have to learn to recover while we're moving forward. And that may be a new skill for some of us. I would say in government, it's probably a new skill because not in everything, but over the long haul, bureaucracy doesn't normally move quickly and like to adjust. And I think those are two things that we're all learning in our businesses, in our homes, and even in our individual way of thinking. We have to be willing to let go quickly of the plans or expectations we had and adjust. And this is a strong skill. It's the skill of resiliency, and I think it will benefit us over time as a city that we're working on this skill, even though we might not be choosing to work on it voluntarily. So for our doctors and nurses, thank you. Thank you so much for anyone who's working in the medical field for running this COVID marathon for us. For our business owners, it is a marathon. Adjusting your schedules, adjusting your business model, adjusting your budgets. It's a marathon. Thank you for the sacrifices that you're making. For our parents and our kids, it is hard. There are sad moments. You're fighting depression. You're fighting disappointment. Thank you. Thank you for being on the marathon of choosing every day to find someone new to encourage. It's hard, but I appreciate the work that you're doing. Just for every citizen in our city, thank you for making the adjustments and having the endurance to not let COVID get us down. We'll pull together as a city instead of pulling apart as a city. And I know that we will see a finish line on this Sunday. I love this quote from Henry Nouwen, and it says, "Those who keep speaking about the sun while walking under a cloudy sky are messengers of hope." And that's where we are in our COVID journey, Amarillo, is we're still under the cloudy skies of COVID, but that does not mean that each one of us can't be a messenger of hope. Be willing to adjust, be willing to change your expectations, and most importantly, look for opportunities to encourage people, whether that's your neighbor, whether it's someone you do business with, whether it's your employees. And if you have the opportunity to encourage a first responder or someone who's on the front lines of our medical community, please, absolutely tell them thank you and speak a word of encouragement to them. I'm convinced that we have what it takes to run this marathon and to pick up the skill of learning to adjust while we're still moving forward. So thank you for encouraging and inspiring me, Amarillo, and that's all I have today, Dave.
Thank you, Mayor. At this time, let's now go to City of Amarillo Public Health Director, Casey Stoughton. Casey, how are you this morning?
I'm good, thank you, Dave. So to go through some numbers, as of yesterday, there were a total of 4,214 cases of COVID-19 in Potter and Randall counties. 3,081 in Potter County, and 1,133 in Randall County. We have a total of 3,687 recoveries and 46 deaths reported in our community. That leaves us with 481 active cases. Yesterday was the day before yesterday was the first day that Randall County had more active cases than Potter County. The 230 report card will reflect additional information, so please visit www.amarillo.amarilloalerts.com and you can see the dashboard and the report card there at 230. Each of the cases that we talk about represent a unique individual. The staff at Public Health take out any of the duplicate test results and only report out unique individuals. Right now, the public health team remains diligent in working with patients on contact investigations, and we sure appreciate their hard work. Instead of one or two large outbreaks, we're currently seeing many smaller clusters, indicating that we're moving about quite a bit. Clusters resulting from the 4th of July get-togethers, graduation parties, family get-togethers, workplaces, youth and adult sporting events, and religious events are some of the places that we're seeing clusters. Currently, we're seeing our highest numbers in younger people in their 20s and 30s, but we are seeing cases across the board. So what we're seeing is lots and lots of gathering. We're still in the season where prevention is key. Wearing a mask, staying 6 feet from others, good hand washing, and limiting social groups remain critical in preventing COVID-19 for yourselves and your loved ones. So just continue to do those prevention tips that we've talked about, and we sure appreciate everyone's hard work in this situation. That's all I have, Dave.
Thank you, Casey. This time, let's go to Dr. Scott Milton, Public Health Authority, Texas State University Health Sciences Center. Dr. Milton, how are you? Hold on, Dr. Milton. I think you're muted there.
Okay. Can you hear me?
We got you now. How are you, Dr. Milton?
Okay, good. So yes, I'd like to just reiterate the fact that social distancing is so important and wearing a mask is so important when you're out in the public if you can't stay more than 6 feet away from an individual. As Casey alluded to, we continue to see cases in the community, generalized in the community with small hotspots that reflect community gatherings, et cetera. There is even, I think, another vulnerable population. I think a nursing home last week has had a problem with that, and we are aware of that and actively working that up. In terms of our hospitals, I know Brian and Mike will do a great job in giving us an update. Generally speaking, it is busier in the hospitals for COVID, and we are still actively admitting patients and evaluating them for the different modes of treatment, mainly which consist of dexamethasone and remdesivir. We still have an adequate supply of remdesivir. I'm certain Brian and Mike will give us more information about that. And as time goes on, I think that we will continue to see cases. And I think the way to mitigate that, as I mentioned, was what I first said. We need to practice social distancing and keep that in mind and try to take care of those individuals who'd be most at risk of developing a complication from this. And that's all I have to say, Dave. Thank you.
Thank you, Dr. Milton. This time, let's go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Weiss, how are you?
I'm doing well, thank you. Hey, good morning from Northwest Texas. So it was interesting. Scientists are learning a great deal about this virus. And one thing we are recognizing is this is a smarter than your average virus. For instance, when this virus makes copies of itself, it has the ability to go back and proofread what it did and to fix errors that it makes. So, but by contrast, HIV does not have that ability. So when HIV copies itself, it makes mistakes and it can't fix those. And a lot of those copies it makes are non-functional viruses because of mistakes. COVID-19 is very different. It has the ability to proofread its copies. And so every copy it makes is an accurate copy of the virus, which makes it all the more infectious. And the other thing we're realizing now too is this virus has developed a way of eluding or staying under the radar of the immune system, our defense system, at least for a while. So we've been trying to explain, why do people go 8, 10, 12 days and then they become very sick? And what we now appreciate is that's probably by 8 or 10 days, that's the time the immune system catches up. And when it does, it overreacts to the presence of the virus. So what we're learning, the reason I bring this up is, if this is a smarter than average virus, we've got to be smarter the way we protect ourselves. Hey, this is not the common cold. This is very different. So again, all the things that the mayor's talked about, that Dr. Milton's talked about, that protect us, the mask, the distancing, we've got to keep our guard up, because this is a very clever virus. Now, in regard to the numbers at Northwest, so just remind you, 2 weeks ago this day, we were at 7 positives in the hospital. Now we're at 23. Okay, so we've over tripled our number in 2 weeks. Okay, we have 8 patients in our ICU, 4 of which are on ventilators. Okay, unfortunately, last night we had a younger person die from COVID in our hospital. And that is absolutely catastrophic for the family, catastrophic for our staff. And it just drives home how dangerous this virus can be. Yesterday, we did receive a patient from the Rio Grande Valley. That is an intubated COVID patient. Okay? Again, this hospital told us we were the first hospital between them and us that could accept this patient because of capacity concerns. Okay? So now we're starting to see some of these southern hospitals, southern Texas hospitals, now relying on some of us up here for help and assistance in just the overwhelming number of virus cases they have there. We're getting requests for respiratory equipment and for PPE, and we're doing our best to try to accommodate this request from some of these hospitals down south. With regard to our employees, right now we have 9 quarantined. We've had 3 employees test positive since the beginning of July. We know that all 3 of those are community acquired and not hospital acquired COVID. So again, you're almost safer in the hospital than you are out in the community with regard to exposures to this virus. As Dr. Milton talked about remdesivir, right now we have 80 vials left of the supplies that were given out by the state and by the federal government. That's enough to treat about 8 to 16 patients. After that, we have to start purchasing remdesivir. We have been promised that we will get 40 vials every 2 weeks as part of our supply. So that's enough for typically about 8 patients at most to treat. So that's every 2 weeks, 40 vials. And it will cost about $2,500 to $5,000 for treating these patients with the remdesivir. But we will continue to get that biweekly supply as much as we can. And finally, there was some question about testing. We are seeing some more issues with testing. One thing, we're having trouble getting the rapid turnaround tests that Dr. Lamentier and I talk about. The second is that our send-out lab, we were getting 48-hour turnaround time. That's now going out to 3 or 4 days turnaround time. And it's mostly because that lab is being overrun by all the increased volume that they're seeing. So again, this puts us in a tough situation where it may take us sometimes up to a week to get a result on a test. So that's all I have for today. Thank you.
Thank you, Dr. Weiss. At this time, let's now go to Dr. Michael Lamentier, Chief Medical Officer for BSA. Dr. Lamentier, how are you?
I'm doing well. Good morning, everybody. I'd like to start off with some statistics for BSA in terms of where we've been. I think analogous to what Dr. Weiss said, from the standpoint of the rising number of cases in our community across the state of Texas, across the southern regions of the United States, we have seen an uptick here recently in our inpatient volume. 2 weeks ago, we had 18 patients in-house that were confirmed COVID cases. Last week, when I reported to you, we had 27, and today we have 29. We've been hovering in the high 20s for the past several days up to this past week. And again, I think this is a reflection of the augmented number of cases we're seeing across the state in terms of some of the reopening, in terms of the recent holiday, and some of the aftermath of the gathering that probably occurred in some of those settings. I think it's important to note in the setting of what Dr. Weiss said as well, in terms of the death of a young patient. I was looking at the age demographics on our inpatients today, and of the 29 that we have in-house, 8 of those patients are less than 50 years of age, and of those 8, 5 of them are less than 40 years of age. So this virus does not only affect the elderly, it does not only affect the infirmed. Certainly those individuals have greater risk of having a more severe course, have greater risk of having mortality, when they have the comorbidities that we're aware of, such as coronary disease, hypertension, diabetes, chronic lung disease. Regardless, there are some healthy individuals that are getting very sick. So we need to be cautious. We need to be cognizant of that fact, and we need to maintain diligence when it comes to the social distancing and the masking policies that have been laid out by our governor, by our local government, our mayor, and also by the institutions where we work and attend every day. Of the 29 patients that we have in the hospital, 13 of them today are 12 of them are in the ICU, and 6 of them are on ventilators. We are, again, maintaining close to that 50-50 breakdown of people requiring the ICU versus those that are requiring a med-surg unit. In terms of testing, we actually have very ample rapid test kit inventory currently. It is very much helping us manage those patients that are, number one, coming into our hospital as inpatients or PUIs, patients under investigation, and also those that are coming for any type of surgical procedure so that we can help to put them into our pre-op testing protocol. As far as surgeries go, we are continuing with elective cases. We are very carefully monitoring our surgical schedule on a daily and weekly basis, and we are making sure that we have adequate ICU capacity in terms of handling COVID cases so that we do not get in a situation where we are unable to manage those patients. Our turnaround times have actually been fairly good. The rapid test is a non-issue for both hospitals. In terms of the send-outs, we're getting pretty good turnaround time still through our send-out laboratory, less than 48 hours. Again, there have been some times when that has slowed down because of testing volume, but at this time we're maintaining a good cadence on that turnaround. We've now tested since the beginning of the pandemic over 5,300 patients for COVID. We're maintaining that overall 18% positivity rate, which I think I've quoted on multiple weeks in terms of where the percentage of positives seems to be hovering. And as far as our preoperative testing, that continues to be a very low percentage of patients through our screening protocol that test positively, less than 1%, and that's been maintaining a constant statistic for us. We are now up to 29 total patients that we've treated with remdesivir, and we continue to have a fairly adequate supply. We are going through the process required by the state of Texas for us to report our statistics, and they will determine how we get allocated remdesivir. So we are following all those rules and regulations in terms of reporting so the state can make good decisions about who should be getting more doses of remdesivir and who should be getting smaller allocations. I do want to point out that it was interesting in some of the reading I've done this week, and probably many of you have seen, there's going to be a phase 3 trial on a messenger RNA vaccine that's going to be begun later this month. One thing I think that's a little bit always a little bit of a cautious optimism is that this is a rapid course to a phase 3 trial for this vaccine based on how we typically let vaccines get into trials in terms of the expedience with which that happens. The good news is that things went fairly well in the first phase of that study. So we're hoping, all of us are hoping across the country, I believe, that we're going to get some good results out of this. I think there's some determinations to be made about the dosing that's going to be optimal and not cause side effects. But I personally believe that this is going to be our savior. Mayor Nelson talked about what is going to be the answer. This is not a sprint. She is absolutely right. This is a marathon. It will probably be an eventual vaccine. It still may be a year till we get where this is going to be something that's able to be offered to the public. But it looks like everyone in our country that's some of the brightest minds are really working hard to accelerate these trials, which I think is encouraging for our country in terms of how we're pulling together. Last thing I'll say is we maintain a visitation policy that is 1 visitor per patient at BSA. This may change if we get higher case numbers. As you all know, if the case numbers increase, having visitors increases the risk for staff and even potentially patients. And therefore, we may have to go back to more restricted visitation, but at this time, we don't feel that is necessary. And we are also evaluating and planning to move forward with some more strict masking policies within the hospital in an effort to try to protect our staff members to an even greater degree, so that we can optimally provide them protection while also being good stewards of our resources in terms of mask inventory. I think that's all I have today. Thank you very much.
Thank you, Dr. Lamentier. At this time, let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you this morning?
I'm doing well, thank you. Good morning, this is Dr. Gonzalez. Thank you again for this opportunity. First of all, let me just go through our numbers. Right now, we only have one inpatient who is on our med-surg ward. We do have 16 COVID patients, positive patients that we've tested who are at home. We do not have any PUIs for which we are waiting test results at this time. And then when we look at how many tests we have done, we have 19 that have recovered from the COVID. I would like to remind our veterans that we will be reinstating a limited number of face-to-face appointments for the Amarillo VA beginning Monday, July 20th. Our staff are really excited and ready to serve our veterans in these routine appointments. I would like to, however, underline, we still have a limited access policy where we are not allowing visitors. We do allow a single caregiver when that is necessary. And wearing masks is expected while on our campus. I know hearing from some of my team this week, we've had a few issues of that. But we do expect people, both staff and patients, to be wearing a mask when they're on the campus. We also will be doing COVID-19 screens. So for veterans who may not have been here since the COVID concerns have occurred, you'll notice that we're doing extra screenings as you come onto campus and when you enter our buildings. I would like to remind everyone the safe habits have been iterated by many of wearing your face mask, doing hand washing, and practice social distancing. And finally, before I close, I do want to mention that next Tuesday, on the 21st of July, the VA is going to be celebrating its 90th years of serving our veterans. One thing to note is just 2 years after the VA celebrated in 1932, the VA had to create an emergency hospital at Fort Hunt, Virginia, in response to an increase of disease in veterans along the Anacostia River. That hospital would eventually treat 282 veterans for various contagious diseases. And today we continue that same charge to serve our veterans at their time of need. It is our commitment to stand by our veterans during this pandemic and to provide services for the men and women who have served our country through their military service. And I'd like to thank both the City of Amarillo and Mayor Nelson for this time. And Mayor Nelson, you mentioned about words of encouragement. Just interesting, just today I'd mentioned to all of our service chiefs about going out and saying thank you to people that are helping them out. You know, in all that we do, sometimes we forget all the people that help. And so I wanted to remind people just to say thank you to those, not necessarily that work in their same area, but those that support their area. And so with that, thank you for this time.
Thank you, Dr. Gonzalez. Let's now go to City Manager Jared Miller. Jared, how are you?
Thanks, Dave. Oh, doing good. Thanks, Dave. Just want to remind everyone the drive-through testing center is still open. If you feel like you're sick and you have symptoms you think might be COVID, call the public health hotline at 378-6300. You'll be screened for the drive-through testing center. Location of the testing center has been moved to a city-owned building in downtown Amarillo. Directions to the location are going to be provided when you call in the hotline to be screened. The most noteworthy executive orders from the governor that we are currently under right now are GA-28, GA-29, along with a proclamation that the governor put out on the same day as GA-29. I want to summarize a couple of the key aspects of GA-28, then address the related proclamation and GA-29. The GA-28 superseded GA-26. It continues until modified, amended, rescinded, or superseded by the governor. We have had a number of questions from people asking if we know when the governor is going to have a follow-on order. We don't, but we do anticipate that given the activity we've seen in south of us and in other parts of Texas, demonstrating significant levels of growth and challenges with hospital capacity, that might happen in the near future. We continue to pay attention to that, and as soon as that happens, if it happens, we'll put it out and make sure that everyone's aware of it. But with regard to GA-28, there's no occupancy limits on essential critical infrastructure, religious services, local government operations, child care services, youth camps, and recreational sports programs for youth and adults. All of those activities still have to follow the governor's following Open Texas guidelines. So they do have mask requirements, they do have distancing requirements, sanitation requirements, hand washing requirements, things like that, but they can operate at 100% capacity. 50% capacity limits on outdoor areas, events, or establishments for professional, collegiate, or similar sporting events, amusement parks, swimming pools, water parks, museums and libraries, rodeos, and equestrian events. Every establishment has to operate at no more than 50% capacity, in addition to the following areas. Restaurants moved as part of GA28 from 75% back to 50%, and that started on Monday, June 29th. Outdoor patios are not separately defined in GA28. Bars are closed, and that's been effective since June 26th. They can continue to do takeout or delivery of food or alcoholic beverages as authorized by TABC. GA29 required every person to wear a face mask over the nose and mouth when inside a commercial entity or other building or space open to the public, or when they're in an outdoor space wherever it's not possible or feasible to maintain 6 feet of social distancing from another person not in the same household. The face covering requirement does not apply to a number of categories, and I want to make sure and point those out to people. Any person younger than 10 years of age, any person with a medical or disability that prevents them wearing a face mask, any person while the person is consuming food or drink or is seated in a restaurant to consume food or drink, any person while the person is exercising outdoors or engaging in physical activity and maintaining a safe distance from other people not in the same household, any person while the person is driving alone or with passengers who are part of the same household as the driver, any person obtaining a service that requires a temporary removal of face covering for security purposes, for example, to use your Face ID on your phone when you're paying for something. But you do have to replace the face covering immediately upon conclusion of that security screening. Any person while the person is swimming in a pool, lake, or similar body of water, any person participating in voting. But again, wearing the face covering is strongly encouraged. We saw that yesterday. Any person who's actively providing or obtaining access to religious worship, and again, wearing a face covering is strongly encouraged, even requested. Any person while the person is giving a speech or a broadcast to an audience. There's no exception to the face covering requirement for any person attending a protest or demonstration involving more than 10 people, or who is not practicing safe social distancing of 6 feet from other people not in the same household. Following a verbal or written warning for a first-time violator of the face covering requirement, according to the governor's order, a person's second violation can be punishable by a fine not to exceed $250. To date, every time we have interacted with people and citizens regarding the face covering requirement, they have immediately complied. And so we have not issued any citations to date. That's all I have, Dave.
Thank you, Jared. At this time, we're now going to open it up to questions from our media. If you have a question for an individual panel member or the panel as a whole, that's perfectly fine. Let's go ahead and start with Dalton Williams of KVAI Channel 7. Dalton, how are you this morning?
I'm good. How are you today?
Very good, thank you.
First, kind of just a little bit towards Jared and Mayor Nelson. Last week, the governor criticized mayors and city officials for not enforcing his masks rule. And when we asked y'all last week what y'all thought about that, you were saying that he wasn't really speaking to y'all when we're still seeing cases rise. And everyone here today is saying speaking about the importance of wearing face masks. Why are we not really enforcing the mask rule?
I don't think anybody ever said we're not enforcing the mask rule.
We asked last week if we were enforcing the mask rule, and it was Morgan Darden who asked you if you were enforcing it, and y'all were saying no, that y'all weren't enforcing the mask rule.
No, we have not said we're not enforcing the mask rule. We are enforcing it. We're working with our citizens to have compliance. We have not issued any citations, but that does not mean that we're not requiring people to wear masks. So it's inaccurate to say we're not enforcing the governor's mask rule.
Okay.
Part of the question, Dalton, part of the question from last week that Morgan posed had to do with mayors and other cities. And so the response that the governor's comments weren't really applying to local leaders in the Panhandle was in response to that portion of her question that many of those mayors are calling out and saying they don't support the governor's decisions. And that is certainly not the local leadership here in the Texas Panhandle. So I think there might be some confusion on, she asked a question that had more than one part to it, and the answers that were given are being assigned to different parts of the question.
Okay. Okay. And then with the citations, why are we not issuing citations and just letting things go to municipal court? We've been speaking with some people from the police station saying that the citations aren't being issued, or when they get called out, they only are really sending people when there are mass disturbances, like in businesses, like people are refusing to leave or not wear the face masks there. But when it's just one person not wearing a face mask, we're just sending them to municipal court instead of issuing a citation.
The objective of the governor and of local enforcement is compliance, not citations. Because we've been able to achieve compliance in every situation where we've interacted with people regarding the face covering requirements, there's not been a requirement for or a need for citations at this point.
And let me just say thank you to Amarillo. I know many of you are not comfortable wearing a mask and you'd rather not wear it, but I am so thankful to everyone who sees the benefit of just doing it, and also to the people who are practical enough to see that the governor's leadership is just trying to keep us all safe. So just in practicality, putting it on, going and taking care of your business, getting not wear it when you're in your house. That's the Panhandle people that I appreciate. And I want to say thank you to each one of you who are following that approach.
And I think a good example of that is on over the weekend, we had a challenge with West Texas Youth Baseball league play. And when we discussed it with them, they went ahead and canceled the league play on Sunday immediately, put together remedial actions and guidelines for all of their parents and participants to ensure that they're in compliance with the governor's order, and resumed play on Monday. So they've had good compliance with their parents and participants. It was not happening on Sunday. So people have been responsive.
Yeah, that's a great example. And we do appreciate the leadership of that baseball league and all the parents who want to see their kids out there. We want to see those kids out there playing too.
Exactly. And then I guess kind of my last question, we've also observed police officers not wearing masks. So how are we supposed to like enforce the mask rule when our law enforcement isn't wearing masks? Because we've seen them on like pulling people over and not having masks on in security events such as like watch parties and stuff. Last night we've observed police officers not wearing masks. Are we going to start cracking down on that?
Well, we certainly are going to continue to work with everybody that's affected by the face covering requirement, including our own personnel. We have to be setting the example, so we'll work on that.
Okay, awesome. That's all the questions I have today. Thank you so much.
Thank you, Dalton. At this time, let's now go to Aaron Langston, KAMR Channel 4. Aaron, how are you?
Good. How are y'all?
Good, Aaron. How are you?
Pretty good. First question is, do you have numbers as to how much of an increase in testing we are seeing now versus a couple weeks ago?
So I can speak to the drive-through. We generally over the probably last month or so averaged about 40 to 60 people through the drive-through a day. We're seeing a little bit of an increase now. We're kind of peaking at about 100 a day. And so we have seen an increase in people wanting to be tested, needing to be tested. So yes, I can only speak to the drive-through. But yes, we have seen an increase in those needing to be tested.
Alrighty. And you said earlier the age group that you're seeing the highest increase in lately is the 20-somethings. Is there any reasoning behind that maybe?
We're seeing lots of gatherings, so 4th of July gatherings, graduation parties, family get-togethers. And so I think, just lots of moving about. Traditionally, the largest age group that we had cases in was in the 30s. And so I think that's, just kind of the age group that moves around more. And so we just want to make sure that we encourage masking and social distancing. This is a hard time, and my heart certainly goes out to to our kids and our young people this is a tough time to be young. And so if we all think about the time that we were in that age group, this is tough to be in that time. And so we just certainly want to encourage them to take those prevention tips and to be to be safe with their activities.
And I'd like to add, I think that initially when we first stepped into this marathon, there was a lot of attention paid to where most of the mortalities were taking place, where most of the fatalities were taking place. And it was in our older populations. And it continues to be a high risk population, but it implied a sense of immunity or less susceptibility to younger people. We're finding now that that's, obviously not absolutely the case. So everybody needs to take very seriously the things that we know reduce the transmission of coronavirus, including the masks, hand washing, sanitation measures, things like that.
Alrighty. And with the recent increases we are seeing in the number of cases, how close are we to bumping up to the highest level again?
As far as moving to the highest level, we anticipate that if the governor is going to make a change, that would push us there. Or if we have significant, far exceeding where we're currently at, community spread, or if our hospital capacity gets to a point where we have to protect that, and we're close. We're not that far away on the hospital capacity. So there's a number of factors that could push us to a condition red, or as the governor has stated, to stage 1 or even complete shutdown. I don't know what the next step the governor is going to order is, and I may have spoken on top of where Casey Stoughton or Dr. Milton or one of the other doctors or mayor on the panel would want to provide some input. But we're expecting some input from the governor at some point in the near future. But there are local things that could push us to condition red, which is just an independent alert status for here at the city of Amarillo and our entire health district.
And I would say from the hospital, at least from Northwest, we are concerned too. We had opened up our visitation to 2 visitors per room. We're already talking about maybe, as Dr. Lamentier was talking about, maybe having to go back to 1 or none if we continue to escalate. I think the thing that we really want to avoid most is having to shut down elective procedures again. A lot of people were waiting a long time for surgeries they needed and procedures they needed, and that'll be the last thing we do, is shut down elective procedures. But we know that hospitals in Dallas are starting to do that already voluntarily because of the concern. So that's kind of where we are at Northwest.
Alrighty. And where are the hospitals sitting right now as to their capacity for COVID treatment?
This is Dr. Lamentier at BSA. We are in good shape right now. Our ICU status and capacity has been fluctuating over the past couple of weeks. We'll have days where we're near full capacity, obviously from largely non-COVID patients. And then we have days like today where that capacity has improved. We're able to get patients transferred out to lower level of care, to our med-surg units. Again, we have more capabilities. So as you recall, we had surge planning over the past several months that we looked at ways to augment additional space if needed outside of the historical traditional constraints of our ICU walls. So we still have the ability to look at those options and the capability of doing that. Hopefully we won't have to do so.
Yeah, I would say same thing in Northwest. Right now we're using 16 of our 40 ventilators, but we are getting requests from South Texas to send ventilators and CPAPs and BiPAPs, which are other kind of ventilatory machines down there. This morning we actually had a couple of patients waiting in our emergency room for beds to open up in our medical ICU. So, yeah, we have a surge capacity. We haven't invoked that yet, but in terms of our routine capacity, we are starting to butt up against some limitations there.
All righty. Well, thank you all very much.
Thank you, Aaron. Let's now go to David Gay of Amarillo Globe News. David, how are you?
I'm good. Good morning, everybody. I guess my first question, I want to follow up on something that Dalton mentioned during his questions about more specifically about the watch parties yesterday evening. When I was there, at both watch parties, I did notice that a lot of people who attended were not wearing masks. I guess what would your message be, I guess, from the city level or from the hospital level to those who, despite the order, despite the increase in coronavirus cases in the area and throughout the state, who still do not wear a mask despite the order?
Doctors, will y'all start with that question?
Well, I would say, just to answer that question, we're all tired of this. I mean, I talked to a lot of people, everyone's fatigued. They're tired of talking about COVID, but this is not the time to let our guard down. We just cannot. And that's the thing. I think all these practices that really need to be just commonplace for us to do need to be done. And, I hear people say, well, we really don't believe it's that bad, or that this is a conspiracy of some type. I'd invite you to come walk through our ICU and see these patients, because it's very real. People get very sick, and we just have to keep our guard up, and particularly in these kind of gatherings like took place last night.
And I would just add, again, I think we are practical people here in the Texas Panhandle, and no one would choose to go around with their face covered. No one's chosen for the economic impact. No one's chosen to lose a loved one out of this COVID situation. But all of those are where we are. They're just realities. The sooner we can own up and buck up to facing the realities of this situation, and personally take responsibility for the adjustment that you need to make in your expectations. And you may have to adjust how you go to the grocery store. You may have to adjust how you invite people over for a backyard barbecue. You may need to adjust how you go out to an event such as a watch party. If you're an organizer or the owner of a business that would support an event like that, I'm asking for your cooperation. It's not just, are you going to get sick? It is actually your opportunity as a patriot, as a citizen, to consider the health and well-being of our entire city, our entire medical community, as well as people who have no idea how their body is going to respond to the COVID virus. This is hitting me hard today that we've lost a young person to COVID. And that's the heart of complying with the governor's order. The governor's not trying to control us from Austin. The governor is trying to steer and lead us to handle this situation in a practical, science-based, healthy response. And that's what we're asking people to do. So we're asking you who are law-abiding citizens, make the adjustment, be practical, follow what our leaders are asking us to do. I'm doing it. I'm asking that you would do it. I'm listening. I'm hearing our doctors asking for it. I'm not saying it's easy, but I am saying it's worth doing, and I believe we're up to it.
Yeah, I would add we've all got friends, family members. Some of my most very trusted and dear friends are very resistant to wearing masks, and I understand it. I get it. We're a very independent area of the state. We're self-sufficient. And there's a sense out there that, some people feel that it's not an actual thing. It's no different than flu. Some people feel that you can't tell me what to do. The fact is, the rest of the state, and really, quite frankly, a lot of other states are experiencing some of the largest growth they've ever seen during the entire coronavirus. And our ability to adapt through wearing masks until we have a vaccine or something that can relieve us of that responsibility and requirement is going to enable us to have a different experience than the rest of our state. We saw it on a micro scale with the baseball league. They weren't wearing it. Leadership stopped the league mid-play on Sunday, put out guidance to the rest of to their parents and participants. They immediately adapted so that they could continue playing ball. For us, that story is applied by we adapt. We don't have the same level of positives, the same level of transmission, the same level of hospitalizations, and God forbid, the same level of deaths that the rest of our state and states like Florida and other places are seeing right now. So it's not so much about us conceding to someone can tell us what to do, or it's us trying to assist the governor and our hospitals in keeping people safe. It's much bigger than each one of us. And I think it's incumbent upon anybody who is a leader in a family, a leader in an organization, a leader in their community, to set the example for the people that they're around so that it will be a little bit more widely adopted and we will be safer.
Absolutely, absolutely. And I guess the last question that I have is with the recent increase of active cases in Randall County, recently surpassing the active cases in Potter County, has I guess the testing have there been more testing of Randall County residents, or is this due to specific gatherings that occurred with Randall County residents or within Randall County?
So this is due to just additional cases in Randall County. So lots of gatherings, lots of transmission as we're seeing additional cases in the hospitals. We're seeing additional spread into places where it wasn't necessarily before. And so we just really encourage people to do the right thing and to wear a mask. You know, my grandmother talks about her experience as a young child during World War II, and they planted victory gardens, and they conserved rubber, and they rationed food, and those things seem to pale in comparison. I'm sorry, wearing a mask seems to pale in comparison to the things that they did to support the effort during that time. And so I think that if we can wear a mask to save our neighbors and our loved ones and our family members, then that really seems to be a very easy thing to do. And so staying 6 feet apart, limiting social gatherings, wearing a mask, those things seem very easy to planting a garden to me. I can kill any plant that exists. And so, but I can wear a mask. Like, that's an easy thing to do. And so we are absolutely seeing additional community spread. And so if we can wear a mask and we can socially distance ourselves from each other, those things are very patriotic things that we can do. And so I just think of my grandmother and her experience there during World War II.
And as it relates to testing in Randall County versus Potter County, there's not been any focus on Randall County, no asymptomatic testing or anything like that. It's just an increase in the number of people who are symptomatic coming to get tested and finding they're positive in Randall County relative to Potter County.
Absolutely, absolutely. Well, I appreciate it, guys. Stay safe and have a great rest of y'all's week.
Thank you, David. This time, let's now go to Vinaya Patino of News Channel 10. How are you this morning?
Good, how are you?
Very good, thank you.
Thank you. Hi, everyone. Thank you so much for your time. My first question is, are there any hotspots in the community that people should know about? Dr. Middleton, I know you mentioned there was a nursing home. What information can you share about that case, and are there any other, similar cases?
I think that we're actively working with that facility to do the proper contact investigation, and certainly we've been in communication with them and in communication with the hospitals about that, and so we've had various discussions about how to proceed forward with that. Otherwise, I think as we kind of alluded to earlier, it's mainly small little gatherings or that seem to be more problematic than this one example of a vulnerable population.
All right, thank you. My other question is for Dr. Weiss. Doctor, you mentioned that there was someone that unfortunately died at the hospital. What information can you share, about that? Did this person, you mentioned that they were young, have any, pre-existing conditions or anything like that?
All I can say is that this was a patient in their 30s, and they are the spouse of someone, and they are a parent of someone. So a really tragic death.
Yeah, definitely. And then also with, remdesivir, the last case coming in and you guys having to purchase it now, I know that healthcare, can be different for everyone, but what is kind of the average cost, I guess, of the of the coverage of a typical healthcare insurance?
I guess I'll take that. So these a vial of remdesivir, our costs our cost would be about $525 for a vial. You typically treat a person with a vial a day, except for the first day, you give them 2 vials. So if it's going to be a 5-day treatment, it's going to be 6 vials. If it's going to be a 10-day treatment, it'll be 11 vials. So that's where the cost comes between about $2,500 and about $5,500 for a 5 versus 10-day treatment. We don't know if insurance is going to cover any of this. What we do know, and hospitals are paid in a different way. Hospitals are paid kind of a lump sum based on the diagnosis the person comes in with. So the cost of the drug will come out of that lump sum of money. But at this point, it's still considered an experimental treatment, and we don't see necessarily extra reimbursement for the use of this medication at the present time.
Got it. Thank you. And my last question is for Mayor Ginger Nelson. Mayor, at the beginning of, I think it was June or late May, you had mentioned that the governor was, having calls with a lot of city leaders. And I was wondering, are those calls continuing? And if they are, what are the guidelines that he is offering now?
Yes, I still reach out to the governor's office. I haven't actually spoke to the governor since we were having our spikes at that time that you referenced. But I know the governor is making those phone calls. I participate in a weekly group of the big city mayors, the top 15 cities in the state. And so through our group, we are having frequent conversations with the governor's office. The governor did speak directly to Mayor Dan Pope in Lubbock last week, because Lubbock is struggling to control the spread in their city. So there are multiple avenues that I'm using to stay in touch with the governor's office and his chief of staff. And predicting what's going to happen is an impossible task, because the virus itself is changing things pretty rapidly. So you have to stay in a ready position. I know the governor's office is staying in a ready position. And as this evolves, their leadership has evolved, as all of our leadership has evolved. And we're continuing to learn. I listen closely when the doctors bring us a report on what the virus is doing and the things they're learning scientifically about it, because it helps me as a leader in the city to evolve in my leadership. So I am leaving room for the governor's leadership to continue to evolve as we learn more about the virus and how to fight it, and how we as a community can stay open, stay working, stay going to school, but yet still not overwhelm our hospital capacity and still get good medical care for those who need it. So, all of that combined, there's no way to predict what's coming out of Austin. But I do maintain multiple sources into what the governor is thinking and try to stay on top of that as much as I can, so that we're ready and can anticipate and change quickly if we need to.
Got it. Thank you. Thank you so much all for your time. I appreciate it.
Thank you, Vinay. This time, that's all the questions we had for our media. This concludes